name is Karen Blake, and I am an Indiana State University nursing student. And today I'm going to talk to you about a population at risk, and that is smokers and tobacco users. My learning objectives are that students will be able to name the leading cause of preventable death and disease in the United States. Students will be able to list specific diseases caused by smoking or tobacco use. Students will be able to describe some myths associated with tobacco use and explain how they're incorrect. Students will be able to give examples of how smoking is expensive for both consumers as well as for the country. Students will be able to describe what positive effects occur with tobacco cessation, and students will be able to give examples of ways to quit smoking. Please take a moment now to pause the video and look at the link below to take the pretest before moving on. One of the most important facts about smoking is that it is the leading cause of preventable death in the United States. According to the World Health Organization, smoking causes over 7 million deaths worldwide. If you are a smoker, I want to encourage you to ask yourself these two questions. What is your reason for smoking? And what reasons can you list for quitting? I used to believe the myth that the only thing that you could get from smoking was lung cancer. Unfortunately, that's not true. There are a multitude of different cancers as well as other diseases you can get by smoking and tobacco use. Smoking causes cancers of the mouth, the throat, the esophagus, cancer of the bladder, the colon, the rectum, kidneys, liver, pancreas, stomach, trachea, bronchus, and lung. Smoking can even cause a form of leukemia. But it's not just cancer you have to worry about. Smoking is a leading cause of heart disease. It will damage your blood vessels, cause their diameters to shrink. This will increase your blood pressure, and it can also cause clots. Clots can lead to strokes, DVTs, and pulmonary embolisms. Damage to your blood vessels can also reduce the flow of blood to your extremities, and this can cause great pain and disability. Another terrible thing is that smoking causes inflammation. It can lower your immune system's ability to fight. Smoking can also affect your sexual function and your ability to conceive for both men and women. For men, it can cause erectile dysfunction as well as infertility, and women, it can also cause infertility. If you are able to get pregnant, continuing to smoke through pregnancy and after can cause significant issues for the baby. Babies born to smokers are more likely to die in the womb, they're more likely to have a low weight at birth, and they're more likely to be a victim of sudden infant death syndrome after birth. There are all kinds of myths associated with smoking. And one of them is, there is no point in quitting, I've already damaged my body. This is not true at all. As soon as 20 minutes after you smoke your last cigarette, things actually start to normalize. Your blood pressure and pulse drops back to normal. In 12 hours, your oxygen levels increase. Your lungs start to improve just a week after quitting. Nerve endings start repairing themselves, and after a year, your risk of heart disease is already cut in half. The longer you continue without smoking, your risks of developing all smoking-related diseases declines dramatically. That is widely believed is that if you cut back your smoking to just a few cigarettes a day or even one cigarette a day, that you will decrease your risk for smoking-related diseases and cancers. And unfortunately, that is just not true. Every cigarette you decide to smoke every day puts you at risk for smoking-related diseases and cancers. My own personal experience with this is my mother. She started smoking back in the 50s when they didn't know that smoking was bad for you. And she started smoking because she was on a bus every day commuting to college. She was 18 and everybody on the bus was smoking. And if you're a non-smoker, you know it's not pleasant to be surrounded by smokers when you're not smoking. So it was kind of like, join them and maybe it wouldn't be so bad. So she did, and she smoked all the way up until we found out it's not good for you. And she had such a hard time quitting. But she smoked very little. She smoked maybe a cigarette a day, maybe two. That was always the excuse. Oh, she doesn't smoke that much. But she actually died of, she had lung cancer. She developed also another kind of cancer. She actually survived the lung cancer, but the other cancer was what eventually killed her, causing a blockage in her intestines, and there was nothing else that could be done. So it doesn't matter how little you smoke. Another myth is that smoking something besides cigarettes, like pipes or cigars or using chewing tobacco, will be better for my health. This isn't true either. Even without inhaling, you're still introducing chemicals and carcinogens into your mouth and bloodstream. Tobacco products are just not safe, period. A fifth myth is that there's no point in using nicotine products to quit because they're just as bad for me. Nicotine products like lozenges and gum actually deliver nicotine at a much lower rate, and they don't include the addition of tar and a multitude of other carcinogens in tobacco products. We also need to consider the cost of smoking. The average cost of a pack of cigarettes in the US is approximately $7. So if you smoke a pack a day, then we are looking at $49 approximately per week in cigarettes alone. So if you continue smoking approximately a pack per week, we are looking at approximately $196 a month. If you go with 52 weeks in a year, multiply it by how much it costs per week, we are looking at approximately $2,548 in a year. There's a lot you could do with that. Keep in mind that smoking is something that you might choose to do, but it's not all about you. It does affect more than just you. Your choices do matter. Smoking actually costs the United States over $300 billion a year. We have to think about money lost because of the care of smokers and lost productivity because of their illnesses and death. We all pay for this. Think about your family members as well. Secondhand smoke is dangerous for those around you. Even secondhand smoke can cause heart disease, lung cancer, and strokes. Smoking around children can cause ear infections, respiratory issues, bronchitis, and pneumonia. Infants exposed to secondhand smoke have a much higher likelihood of dying from SIDS. If you're trying to quit smoking, there are many resources available for you. It's a very difficult thing to do, and many people find that they're just not able to do it on their own. Remember, you can quit. You just may need some help getting there. Write down your reasons to quit and focus on these reasons when you feel like cheating. Reward yourself weekly when you get through a week without smoking. Stock up on healthy snacks. Eat one when you get a craving. Avoid situations or places that will trigger you to want to smoke. Try nicotine gum or patches, or just chew regular gum to keep your mouth busy. If you need extra help, you can try a counselor. Behavioral therapy can help. And there are prescription meds you can take that can help curb cravings and your desire to smoke. Trying some new activities that you've always wanted to try with some non-smoking friends is a great way as well. And remember, if you have a moment of weakness and smoke a cigarette, forgive yourself. Give yourself grace and move on. You have not failed. Get up and begin again. You've got this. Please also check out some real stories from former smokers to help you on your journey.